Hello, I am Gina Romines from the Vincennes University HUMN 245 class, and here with me today I have my friend Kirsten Lindblom. I will be going over and presenting problems with unequal access to healthcare. Healthcare inequality has been an issue that has plagued people for years in many countries, the United States being one of the most notorious hosts. Healthcare inequality strikes at those who cannot afford healthcare due to their income levels, or they are not granted equal treatment due to literacy rates, age, gender, orientation, race, language barriers, or overall socioeconomic status. Typically, healthcare inequality is most closely linked to low income, as people who cannot afford the treatments, medicines, surgeries, therapies, etc. that they need are often disregarded and forced to do without. Their health and the health of their dependents are at risk for their safety, vitality, and overall lives. When you break it down, there are both healthcare inequalities and inequities. Healthcare inequalities typically encompass differences in the conditions, the diseases, outcomes, and availability of healthcare that arise between different populations, while healthcare inequities revolve around social injustices that target certain groups more than others. Normally, groups of lower class incomes are more vulnerable, as they may not be able to afford the resources that they need. Members of my own family have experienced both, especially on the maternal side of my family. And today I will be sharing a couple experiences from my mother and grandmother that would offer some insight on the lives of people who have had to do without. I pulled one paragraph from my presentation paper, which reads as the following. Health inequality is still a large problem today due to many people below the line for what qualifies them as being able to afford health care. They would rather risk driving themselves to the hospital in the case of an emergency due to the price of an ambulance alone typically costing us several $1,000s. Take a pregnant woman who cannot afford very beneficial health insurance, for example. Having gone into labor, she has very few options on how to act about the up-and-coming arrival of her child. She can call an ambulance to have it bring it to her local hospital, depend on someone she knows to transport her, she may drive herself, or she may not even go to the hospital. There are many risks that accompany some of the decisions that this particular woman could potentially make. One, she could risk getting into a car wreck or potentially harming herself and her unborn child if she does not go through with calling an ambulance, which in the end would be the safest route. Another risk that could occur if the woman stayed home to give birth would be the risk of her infant being exposed to bacteria and other germs. Not being around professionals who can administer medicines and other vitamins to the infant and the mother is much more risky. However, the mother may overlook this and take the risk anyway in order to save money. Without being able to afford health care, many U.S. citizens have had to bank on their lives and the lives of their dependents. Some must do without, and some simply will not thrive. I like this example that I came up with because it challenges people to think about such a seemingly small choice that mothers have to make every day, when really the outcome has so much weight to it. Choices like this one have had to be made by some people who are very personal to me, such as my grandmother. As I have been growing up, my mother has told me several stories that explain all of the things that she could hardly afford as a child. My grandmother had a very low-paying job, to which my mother would describe as being raised off the tips that my mother made. My mother would tell me about how she had to have several adult teeth pulled out when she was younger, as my grandmother, a single mother of two, could not afford to have my mother's teeth treated properly at the hands of a dentist. This is a prime example of how, due to not having good access to good health insurance, my mother now has to deal with several missing adult teeth at the age of 56. Unfortunately, many families like my mother's have had to do without some seemingly simple solutions to their health issues, and sometimes after you make a choice, there's no going back. For a visual and auditory demonstration, I have pulled a 3-minute clip from PBS's Dr. Hotspot report titled Frontline. It focuses on an area of serious poverty in New Jersey, and it covers a particular incident where someone had been shot in a gunfight. The physician who arrived to the accident in the neighborhood had asked the other police officers and medical professionals where the victim of the shooting was, and they had simply left him to die on the side of the street. Rather, they made excuses as to why they did not help him instead of attending to him, as shown here.
They were ready, so I ran up and said, I'm a physician, where's the victim? And they all sort of turned around and said, he's over there.
What is the location?
He was laying on his side facing the back tire, and he had a pulse. He wasn't breathing, started rescue breathing. Eventually his pulse stops. So I was just pretty overwhelmed by the whole thing and angry, and
you were angry that they hadn't been even tending to the victim.
I said, why didn't you guys help him? And the police officer said, we didn't want to dislodge the bullet. It was just a complete blow-off. And I couldn't imagine how we could have reached the point in our society, in this city, where you would just leave a victim lying there in their own blood. He was a Rutgers student, and he was close to graduating. He was one of the wonder kids that make it out of urban communities. And here he was just about to make it out.
Brenner's immediate response was to get involved in police reform. He thought if he could get a hold of crime statistics, he could map hotspots, the places where good policing would make a difference. But the department wasn't interested in helping a local doctor. So he went to another place, one he knew well, the hospital. There, buried in billing records from the ER where violent assaults get treated, he found crime patterns. As he crunched the hospital data, Brenner discovered something totally unexpected: other kinds of hotspots.
It became clear that there were hotspots of everything. There were hotspots by disease, hotspots by patient. There were certain patients who'd been over and over and over going to the emergency room and hospital too much. There were hotspots by zip code and by neighborhood. And so you sit and begin to look through the data, and I'm looking at my patients who are in the data and realizing I had no idea how much healthcare cost. I had no idea how expensive it was, and it was just shocking.
Brenner says the numbers showed that 1% of people living in Camden accounted for 30% of hospital charges, most of those racked up in the emergency room. So you're compiling all of this information coming from all of the hospitals in the local area.
Compiling massive amounts of data, so a full...
Brenner then turned that raw information into visual information.
So this is a map of the city of Camden, and this is looking at cost data. So the red areas are high-cost hotspots. These are parts of the community where people who have more than $1 million in payments to the hospitals live, and this is over a 5.5-year period.
So here you pulled out the two most expensive city blocks.
Yep.
But you found in your community there are two buildings
That's right.
that are the most expensive places.
That's exactly right. So the building on the bottom, Abigail House, is a nursing home. And the top one, Northgate 2, is an apartment tower with elderly and disabled people.
$83 million in bills.
That's...
So this video is just one example of the many inconsistencies in treating patients today. In short, people are dying, but not enough people want to solve the issue due to lacking power, not being able to afford change, or simply being oblivious. For example, the victim in the video was an African-American high school student, and he was preparing to graduate from high school and enter the real world just like everyone else. People need to be more like the physician in this video. They must develop desire to assist and find solutions, because the real question is, who is next? To sum up everything, I'm going over a basic chart by a member of Khan Academy that covers many interconnections between the aspects that define healthcare inequality. Such aspects range from research, gender, orientation, race, and socioeconomic status. Due to the chart being very small, I'll go ahead and do a visual demonstration. So starting on the left-hand side of the image, it is implied that more health research is done on males than females. In short, men have more attention and leverage when dealing with their medical conditions in many circumstances. Also tying into gender, men typically have more support behind them, giving them the upper hand in case of an emergency. Regarding sexual orientation and preferences, heterosexual people are prioritized, and as members of the LGBT community face more discrimination, and they have less access to strong healthcare providers. Regarding race, people outside of the Caucasian spectrum have higher morbidity and mortality rates, and lower accessibility and quality rates. And finally, regarding socioeconomic status, the few very wealthy have the most access, the highest quality, and the least risk when healthcare is on the table. The many non-wealthy are left with more risk, lower quality, and less accessibility. These three aspects tie into more risk and accidents when faced with a health issue. Now, I would like to take a minute for my audience member to ask any questions that she may have.
Yes, I was actually wondering if you had an exact number for how many people in the U.S. are suffering from healthcare disparities today.
Okay, that is a very good question. However, due to inconsistencies, errors, etc., It would be very hard to place a cap on exactly how many people are suffering from healthcare inequality, but just know as the income gap is expanding, meaning that the rich become richer and the poor become poorer, the number in question will only continue to grow. And this is why the problem at hand must be battled and tackled now so that we can afford to miss such a consequence.
Yes, okay.
Having gone into more depth of my research, this is where we reach the end of my presentation paper and video. I wish to stress the relevance of this issue today and why society desperately needs to band together to solve the issue. While there is no easy solution, some possible ways to alleviate the problem begin with raising awareness. In other countries, such as Canada and across the world, they have deprivatized healthcare programs so that it is universal and everyone can afford it. The United States does not have this. Some other answers to the problem could be placing caps on how much something costs, developing uniform healthcare plans, studying income gaps, and finding funding to provide for those in need, as too many people are being affected from this issue to simply be swept under the rug. There's no single option that will whisk away everything. That is, there is no umbrella option. However, some of these methods would definitely be steps in the right direction. Once again, I am Gina Romines in the Vincennes University HUMN 245 class, and I would like to thank you for allowing me to go over the problems with unequal healthcare today. Thank you and have a great day.